So, cirrhosis for me is a very important and interesting field because these are the patients that are really sick, and these patients need our support. They have a poor prognosis once the disease is advanced, and we really need to learn more about the disease on the one hand, and also to treat these patients better so that the survival finally will increase, because the overall mortality is still high in this specific patient group, and I think there is a lot of potential for improvement of therapy. It depends a bit on what the cause of cirrhosis is. I mean, it depends a bit where, from a global perspective, you are, whether you have more hepatitis C or whether your problem is mainly alcoholic hepatitis. This is quite prominent in the area where I work, so this is probably the leading cause of cirrhosis, but we also have many patients with hep C, where in other regions this is not so prominent. In other areas, hep B is a leading cause for cirrhosis, and so it differs a bit. Especially for hep C, we now have new treatment options. Of course, we're happy that we can treat these patients now much more efficiently and faster, and with bigger success, and so we have to learn how the impact is, especially in patients with advanced disease. We do not know, especially in advanced cirrhosis, what will be the effect after treatment after 5 or 10 years, so we're still learning now, and but this offers this patient group really the possibility to stabilize the situation and to increase or improve the health condition. And in other diseases, as alcoholic hepatitis or cirrhotic disease due to alcoholic problems, there we still do not have optimal treatment. So basically said, we are still at the same place where we were already 20 years ago. There is not much or not more treatment option available, or what we thought could be helpful did not show to have an additional benefit, and there is still room for improvement. The alpha pump is quite a novel treatment. The data I presented covers patients that received an alpha pump from 2012 to 2014. So this novel treatment is especially for patients with advanced cirrhotic liver disease and with ascites that is refractory. Refractory means that the patient has a repetitive ascites parasitic and usually twice or even 3 times or 4 times per month. And in addition, that there is no other treatment option available. Of course, the first option is to treat them with diuretics, and then if this doesn't work, there is the portosystemic shunt. If TIPS is feasible, then this would be the first option, but this is not always feasible because some patients have hepatic encephalitis and encephalopathy, and if patients have hepatic encephalopathy, this is a contraindication, or in advanced disease with a small liver, this is also usually not feasible. And for this specific patient group, there is so far no other treatment available than repetitive ascites tabs, and the alpha pump gives us now a new option to treat these patients. So the concept is not that new. There were similar techniques tried in the last few decades, but they didn't make it to the market. And the alpha pump now is really the first system that works, and we now have also increasing amount of data that shows that it's feasible, that it's safe, that it's manageable, and therefore this is really a new step in the treatment of these patients. Primarily it was introduced in Europe. In different countries we are a center that has quite a large experience. We are, I don't know whether still, but I think we are the center with the most pumps implanted, and therefore we have quite a good knowledge regarding how the pump works and how it has to be managed. The best thing for a patient is if he has controlled ascites or almost no ascites with the pump. This means that it's easier to eat. The belly is not full, but he can better eat, he can eat more, he's feeling better, and we do not know what exactly influences this, but the goal would be to gain weight and not water, but muscle mass and maybe also fat mass, because nutrition is really a crucial problem in this patient population, and I think this is one of the most important points to achieve regarding long-time survival. Nutrition, that's one thing, and another thing is that they can move around better, they can re-socialize, they are not only at home, but they can walk around, meet friends, and this is really a big achievement if we manage to control the ascites and the patient feel better afterwards. In Europe there are many centers implanting the pump, and they implanted first pumps now in the Americas, and I think that the development is ongoing, and that it will be a question of time until the pump will be available globally, and many patients could benefit from this option.